How does one live with this condition?
Right. So, number one, endometriosis management is multimodal and should be multidisciplinary. So, the lead of an endometriosis management team should be a gynecologist who understands and can handle endometriosis on all aspects, right from diagnosing it, to medically managing it when needed, to surgically correcting it if needed. So, in management, we have the medical options, we have lifestyle options, we have some natural options people have tried. Cumin is some food that we have it's good with cumin. Cumin has been found to be helpful. So there are some dietary advice that we would give people to try. Then there's medical, which is hormonal, and then there's the painkillers. So in hormonal, we have a variety of things that people have tried. And then we have what is called the surgical management. Now that's where it's very important, because what happens is this is not simple surgery. It's one of the most complex surgeries to the extent that some people say, or most people say, it's more complex than cancer surgery, because everything just gets stuck together. And when you are trying to handle that kind of a scenario, you have a very high risk of getting complications. And it's because of this that you will hear very many women coming and telling you they've had repeated surgeries. Most women will have repeated surgeries. So our dictum number one is early diagnosis would help. Two, multimodal treatment would help, and multidisciplinary. Number three, referral to endometriosis experts and centers would help. Number four, the first surgery should be the best surgery and preferably the only surgery. So if we are going the surgical route, which is done for specific reasons, I didn't say every endometriosis patient needs surgery. Yes. But if we are going that route, then the first surgery should be the best surgery and the only surgery.
How do you specialists ensure that happens?
But that's what the whole difficulty is. So I think with correct guidelines and with correct referral systems, if they all land up into centers that deal with endometriosis, then we can handle that. Because if it's not done that way, then someone does the surgery and then after a while the patient is still back with the same symptoms, and they say it's recurrence, but sometimes it's recurrence, but sometimes it's just residual disease. It's disease that never actually came out. So it's because it's in such intricate places and next to such vital structures that people don't go and touch those areas. So you leave it behind. You leave the patient in the same scenario as she was after a few months. So this is what I was saying, that it should be done with an endometriosis expert in an endometriosis center, with a multidisciplinary team, which includes a colorectal surgeon, a urology surgeon, a nurse specialist, a pain specialist, a psychiatrist or psychologist, a physiotherapist. So this is what an endometriosis center entails. Now, if it's done in that kind of a scenario, I think the outcomes are much better.
Right. Okay? Well, then on the back of that, let's talk management. How has